Back again, Dr. Nick with Hannah, and what we're going to do today is I'm going to demonstrate an exam. Now, whenever a patient comes to see us, the first day is where the process is we answer the questions of, is this the right place for you? And we do that by investigating your problem first and foremost with a complete history. We ask you about your life, we have you document your medical history, your social history, your familial history, and then we do a physical exam, typically followed by x-rays. But the physical exam portion is really important for us to measure normals like range of motion, measure muscle strength, measure your reflexes, make sure those are normal, and then we do any orthopedic tests that are indicated. Now, orthopedic test is kind of a fancy term for what would be known as a provocative test, a test where we put our patient into different positions and we push and we pull and we attempt to provoke so that we can go down this funnel of getting more specific as to where somebody's got a problem. Now, if Hannah's got a neck problem, well, I need to know where in her neck is it, because there's a lot of structures in the neck. I need to know what it's affecting, what side, and so I'll use all these tests to determine where to go with treatment and to determine, is this the right treatment for you? Patients always seem to have the same 4 questions, and they go like this. Do you know what's wrong with me? Can you help me? How long is it going to take, and how much is it going to cost, right? I would have those questions too, and that's how we get down the road to answer all those. So I'm going to do an exam on Hannah. I'm going to start with super basic. I'm going to start with the reflexes. So what I'm going to do is I'm going to tap, get this little twitch response. That's normal. Now, if we get less than a twitch, we would call that hyporeflexic. If we get more, or if we get a contraction, we call that hyperreflexic. None of them are good. Hyperreflexic, typically worse. Could you uncross your feet? Perfect. This is everybody's favorite right here. Oh, I think she's not alive. No, she is. So what we can do, now, luckily Hannah's actually got kind of hard reflexes to get. So I'm going to have her do a thing called pre-tension. I'm going to have you take your hands like this, and then when I ask you to, I'm going to have you pull. So go ahead and pull. See the difference? Oh, sorry. Okay, you can relax. So that pre-tensioning helps activate those reflexes. Then I'm going to go to muscle strength testing. Hannah's obviously strong. She's a personal trainer. I'm not looking to see what she can lift. What we're looking to see is how much can her brain send the signal down her spine to activate the body part in question. What we want what we would grade as a 5, which is a complete lockout under resistance. So I'll have you raise your shoulders out to the side. Don't let me push you down. Hold strong. Good. And then hold your hands here. Curl your fists up towards your face. Don't let me pull. Don't let me pull. Good. And then turn them over. Curl your fists up. Don't let me pull. Perfect. Give me a 2 thumbs up and don't let me twist those thumbs in. Nice and strong. Good. Now go ahead and don't let me pinch your fingers together. Hold real strong. Good. Hold strong. Hold strong. And that one. Perfect. Hold your fingers together. Don't let me pull them apart. Oh, hold that one. Got it? And this one. Okay, that's normal. Now what I'm going to do is I'm going to support Hannah's shoulder while she raises a knee, and I'm going to fight her. So go ahead and lift this knee for me, please. Hold strong. Good. Lift this knee. Hold strong. Good. Now, push into my hand like you're kicking a ball. Real hard. Real hard. Good. Push. Real hard. Good. Okay. She did great. I wanted that lockout is what we got. Now, when I check range of motion, the gold standard for is what's called dual inclinometry. It's where we use these angle meters, and we use 2 of them to check and measure ranges of motion. I'm not going to do that for this video, but I'm going to do a gross check of her. It's not disgusting. It's just large scale of her ranges of motion in her neck. Okay, what I can feel and see is that she's got restriction in the left neck on left bending, and then I'll turn, ranges of motion, then we'll go flexion, and we'll go extension. Okay, all looking good. Now, if Hannah's main complaint was a neck problem, I would tip her to the side and I would do a couple orthopedic tests. And I'd push and say, Hannah, is that hurt?
No.
No? Okay. How about this one?
No.
Okay. How about that?
No.
Or that?
No.
So what I'm looking for is I'm looking for discomfort, but more specifically, I'm looking to see if this provokes the problem that she's got. So I'll demonstrate some orthopedic tests on Hannah's low back. Have you lay on your tummy for me, please. And same thing, Hannah, we'll put your hands down there. And I'm going to just say, I'm going to put you in some positions and tell me if this bothers you. How about that?
No.
No? How about that?
No.
That?
Yes.
It does.
Yeah.
In the hip or the low back?
The adductor mostly.
The adductor.
Tight, yeah.
Okay. How about that?
No.
Okay. How about that?
No.
That?
No.
That?
Yes.
Yeah.
Yeah.
Adductor again?
Yep.
Okay.
And the hip.
And the hip? How about that?
No.
Okay. And then I'll have Hannah roll over on her back. We'll complete our orthopedic test on the low back. So I'm going to do, it's called a straight leg raise. It's to check for disc lesions. And so I'm going to lift you up, and stretch is okay, but let me know if this sends any symptoms down your leg.
Okay.
Nothing?
Mm-mm.
Okay. And then I'm going to bend. We're going to check that hip mobility of yours. Oh boy, not so hot. All right, then we'll check here. Any problems in the leg? No? Good, we'll bend you. I'm going to push you. Oh boy, those hips are tight. Now, what we noticed with Hannah's pelvis is that I would expect that she would be able to do this with her hips. However, it may be a flexibility thing, but it also could be that it could be the shape of Hannah's pelvis, or it's called morphology. And if her pelvis, if the acetabulum, which is the sockets that your hip fits in, if those things are turned a certain way, just due to bony restriction, she may not be able to get that range of motion like I can. Okay, so that is an example of a physical exam. Now, obviously, we'll go into specialized testing if we need to. It really is condition dependent. I did a basic one, very basic one, on neck and on low back. So normally we would probably progress to x-rays, and then that would complete the information that we need to take in so that we can determine again, is this the right place for you, right? And then answer those following questions. Do you know what's wrong with me? Can you help me? How long and how much? So hope you found this good. I want to thank Hannah for helping us with this video, and we'll see you back here soon.